Thank you, Jody. Our next speaker is Dr. Jeanie Youngwerth. Jeanie is the director of the Palliative Care Curriculum and Program Director in Palliative Care at the University of Colorado School of Medicine. So, Jeanie, please join me.
Thank you, Joanne. I wanted to start with a story. And this is a story about an individual whose experience changed the way that care for people with serious illness occurs in one organization in rural Colorado. And this community here, this town, is Glenwood Springs. It's about 3.5 hours from Denver, about 30 minutes from Aspen. Maybe you guys have heard of Aspen. And it's a beautiful mountain community. They have a fantastic community hospital there called Valley View Hospital. And at that hospital, they have a cancer care center, which serves that surrounding community as well as the greater mountain community in Colorado. And there was a patient who was being seen at the cancer center who was a young gentleman in his 30s who had advanced cancer. And he had been admitted a couple times that year for normally for pain. And this time he was again admitted with a pain crisis. And this was different from other admissions. This was way more severe. And normally the healthcare team could get on top of his pain relatively quickly. And this time they were not able to. And his pain was escalating and was getting more and more severe. And over time, his organ systems began to shut down. He began getting confused and started to have this severe agitation on top of it. And whenever a healthcare provider would walk into his room, it would just emanate suffering to them. And they were soaking that in and feeling that also. And it became very uncomfortable for everybody, for the patient, his loved ones, and the healthcare team. And so out of desperation, one of his providers decided to call over to the University of Colorado Hospital. And normally, where they might transfer a patient down where they were feeling unable to care for any particular illness, said, you know what, I don't think that this gentleman has time. We don't have the luxury of time right now. And I don't know that he's going to survive that transfer. What can we do to help him? So we brainstormed together and talked and learned more about what was going on with the patient, where it was beyond physical pain. This pain was also incorporating his existential suffering and what was going on with his illness. And so after we talked, the medical team was able to bring back additional care and in different perspectives where they were able to get on top of his pain. And that severe agitation began to dissipate. And now when you walked into the room, it was more described as a feeling of calmness. And as his family described, it was peaceful. And this person his experience had such an impact on that healthcare team, and it went all the way up to the leadership and said, we need to make changes because we have a lot of gaps in the care that we are providing our patients. And what can we do to improve this? And so their chief medical officer reached out to our chief medical officer at the University of Colorado Hospital. They had actually already known each other and said, hey, is there something that we can do to bring palliative care to Valley View? And in fact, our CMO initially started our palliative care program at the university. And the initial thought was, well, hey, maybe you can have your physicians come and provide palliative care to our patients. And we said, we'd love to come to Valley View. It's a gorgeous part of the state. It's so far away. It's at least 3.5 hours on a good day, and that's not when the weather's bad or there's snow on the ground or traffic. And it just wasn't practical. And so we started to explore things more and learned that Valley View had recently developed relations with our neuro hospitalist team stroke program. and had a telestroke that they had started and implemented for stroke alerts at Valley View. And so in talking to their program director, said, I wonder if this is something that we may be able to leverage to be able to bring palliative care to this rural mountain community hospital. And we did a needs assessment and found overwhelmingly, no matter what discipline was asked, and no matter if it was clinicians at the bedside or all the way up to leadership, what was most important, where that gap was learning how to bring out from that patient's story what mattered most to this individual that they were caring for, those values that came through and emanated that we wanted to bring back to their care. And said, you know what, this is more than just about a palliative care physician. This is about a palliative care interdisciplinary team. And at University of Colorado, we feel very strongly in that interdisciplinary team approach, with, at minimum, the core disciplines being the physician, advanced practice provider, social work chaplain, and ideally, additional disciplines. And how can we do this now and bring this model to Valley View to help care for these folks? And so we did decide to leverage telemedicine to bring an innovative care model with an interdisciplinary team that we could bring to the bedside that is composed primarily of the local providers at that hospital. So here is where there's the advanced practice provider, social work, and chaplain from Valley View. And they are working in conjunction, forming a team together with a board-certified hospice and palliative care physician from the university who's brought into the patient's room through telemedicine. And this is how we've been able to bring that interdisciplinary care to each person's bedside. And I am a strong believer of, it was brought up earlier about burnout. I'm a very strong believer around team wellness, and that interdisciplinary team approach could be one of the major keys to addressing wellness and decreasing burnout, not only in our field, but in other fields as well. And so we had implemented this where they have actually fantastic staff retention, which we have experienced at our university as well. And we know that there's a lot of benefits for telemedicine, whether it's around outcomes, definitely increasing access, reducing costs. And probably the question that we get asked the most is, well, what do patients and families actually feel with having the physician there through a video visit? What is that like? And our experience has been that patients and families receive it very well. You know, at first, for some folks, it might be a little bit of a weird experience, and as they get into the encounter, it's something that they feel like that person is there right next to them also. So it's been received extremely well. And our physicians are also acting as mentors for the rest of the palliative care team at Valley View. And the physician assistant at Valley View, who was the original champion for palliative care, decided that he wanted to get additional training in palliative medicine that was formal in addition to that mentoring. And so he enrolled in the University of Colorado Masters of Science in Palliative Care program and achieved his master's. It's a 2-year, primarily online program. And one of the physicians that also joined into the Valley View program decided to enroll in the master's also, and she's currently enrolled. She's an ED physician who does some part-time work with the palliative care team there. And she is going to be in the first cohort of fellows in the AIR program that Dr. Holmbo mentioned earlier, where this is a alternative training track where physicians can go through a fellowship, they can remain in their clinical practice setting, continue to work, and after completion of this program, they can become eligible then for sitting for the hospice and palliative medicine boards to become certified. So this is a way now that we can bring specialty level care and specialty level clinicians to the bedside in these rural communities. The physician assistant who finished the master's program actually looked back and did for his project a program evaluation from when we first started the telemedicine program. And in those first 4 months, they saw 19 patients. Most of that's limited by that this is a part-time program, 2 half-days per week. And the great majority of patients, as you can see, found it extremely helpful. Increased positive outcomes with advanced care planning conversations, documentation of these conversations, as well as completing documents in the electronic health record. And something that I think is probably most meaningful here is all the patients that they were not able to reach speaks to the need that's here. There is a great need. We're just beginning to skim on the surface of it, and we have a lot of work to continue to do. So in summary, I'd say that this innovative team model and bringing the interdisciplinary palliative care can address a lot of that access issues in rural communities and increase the reach of palliative medicine. For workforce shortages, this is where if you start to leverage the alternative training programs, like the Masters of Science in Palliative Care, that actually can train physicians, advanced practice providers, social works, chaplain, psychologists, pharmacists, and other disciplines. They all can go through the Masters of Science program. And for physicians, they have an option to apply for the AIR program. Again, that alternative training program for fellowship, where now you have an alternative track to become board certified in palliative care. So this is where now our ultimate goal with this program is that Valley View becomes self-sustaining with their own team members, and they now have specialty level care with their own providers and that background of that certification and even board certification also. Because in rural communities, you just don't have the specialists. You certainly don't lack serious illness. You don't have the specialists that can help to provide that care. So this is the ultimate goal, is that the need for the University of Colorado Hospital physician being brought in through telehealth to complete that team, that need will lessen more and more over time. So our next steps is to bring telemedicine to the patient's home in the rural community there. There is no existing community palliative care services outside of the hospital right now. And so that's our next step in partnering with Valley View as well as local hospice, is to start talking about how we can do that, and again, leveraging telemedicine. And so in order to bring this model, which is reproducible, and bring it to a scalable level, we do need to have some policy changes and some action items. I know a couple times today was brought up was PCHETA, the Palliative Care and Hospice Education and Training Act, which covers pretty much everything that we've been talking about today, and increasing the workforce for palliative care. In addition would be the Medicare reimbursement for telemedicine, which needs to have expansion on that, as well as being able to be covered for patients who are at their homes to receive telemedicine services in their home setting. And for patients that are in their home to have access to palliative care services that can be reimbursed by in-person visits also. So in the home setting, in-person and telehealth visits are going to be very important and are very important to care for folks. And I think to decrease the burden on patients would be important to eliminate the co-pays that are there now for the telemedicine video visits. This is something that our patients should have easy access to and not have that increase in barrier for payment. In addition, we've been talking again a lot today about the graduate medical education funding. And this can include Medicare-funded graduate medical education fellowship slots, as well as different types of grants to support providers and healthcare professionals that are going through community specialist training programs, including the master's program and the AIR fellowship program. I'd like to give just a big shout out of thanks to our Valley View and University of Colorado palliative care team. They've done an incredible job in making a fantastic, innovative program and really helping to step up that quality of care for patients with serious illness. So thank you.